Hello everyone. So as you people are here today for the topic physiotherapy management of psychological and mental well-being and how to tackle mental well-being issues. So I am Dr. Nitin Arora, the founder of PhyX Solutions. As Dr. Karishma Chawla very rightly explained the topic that how to diagnose a mental health conditions and how many and variety of mental health conditions do we have in our community. So, talking about the practical aspect of how you will be dealing with that thing, so I'm gonna tell you those things. First and foremost, let's take an example. You are in your clinic or hospital setup dealing with a patient, and you are telling the patient, okay, Mr. XYZ, whosoever he or she is, that you need to perform this exercise, let's say 10 times a day, and 2 to 5 repetitions each time, and you're telling the proper exercise routine whatsoever it is, and the patient is looking somewhere else. You are saying, what's happening? I'm talking to you. Being a human being, it's your human nature that you will be saying, why are you looking here and there? What are you seeing? Okay, so what happens is the patient will be like this, and he'll be saying, sir, she'll kill me. Now you'll be saying, who'll kill you? Yeah, nobody is here in my clinic apart from you. So these sort of patients, so that might be a patient of schizophrenia. Or else, let's take another example. A patient comes to your clinic who is sometimes he's praising you like anything. He's so friendly with you, so talkative. He always tells you, oh doctor, you are amazing, you are so good. I didn't find any doctor in this world like you. Although he would not have traveled even outside Delhi only, but he would be talking about the world, like he would not have seen a doctor like you. So that way, and on the next day only, you will find a sort of huge difference in his personality and his way of talking. He'll be coming to you with a bored, hello doctor. So this drastic change, this can be a patient of bipolar disorder, a patient who is having two sort of identities. One day is exhibiting something and the other day something else. So you are sitting and thinking what it is. So this is the very first answer to those people who used to say in their first and second years of bachelor's in physiotherapy that why do we need to study psychology and psychiatry? So this is the reason why do we need to study psychology and psychiatry. Now talking about how to deal these things and what all things you are gonna actually encounter in your physical practice. So first and foremost, what are the issues? So as we talked about the bipolar disorders, the variety of patients, this domain, extreme of happiness and extreme of sadness, the same person exhibiting two things. So you will be bewildered every time you see these patients. Schizophrenia, the person will be looking here and there. He might be looking at faces which he don't know. He might be hearing voices which he haven't heard anyhow in the past, and he might not be knowing what's happening, and he'll be dragging you into the thing. And sometimes it may happen that the patient will come to you, and then let's say he or she is a child of or a adolescent age child of 13-14 years. He'll be coming to you, he'll be going back to his home, and he'll be telling his parents that doctor so and so wanted to kill me, and his parents will be after your life, I'm telling you. So these things you need to be very cautious, you need to be very vigilant how to diagnose these things. The diagnostic criteria you are well aware of now. And so what all things would you be looking at in a patient with a mental health disorder? So when a patient comes to you, when you are doing the observation part, so that is the main part what a physical therapist does. The observation is the best thing that a movement scientist or a physical therapist actually do. So when you will be looking at the patient and the person will be standing, there might be two domains, as I told you, excitability or low sort of energy. So the person, when you will be asking questions about history, you may find that he or she would be telling all the time that doctor, it is my fault only. I did this. I am guilty. I should be blamed for this thing. So you'll get to know that something is there in this patient, that for everything that's happening to his life, everything that's happening to him, he or she is complaining of that he is the main guilty. So that person will be making himself guilty for everything that's happening bad in his life. Along with that thing, whensoever such sort of patient comes to you, you will be feeling, you will be looking at them. But psychological well-being and psychological issues are yellow flags in physiotherapy. So when you diagnose a patient, when you are doing the assessment of a patient, so you have red flags, yellow flags and green flags. Green flags means you can easily go up with the patient. Red flags means a big no. Yellow flags means you should be having relative contraindication. You should be assessing the patients on the risk of biases, on the risk of what good things you can take in that patient, what bad things you can take out of that patient. So these things you should be well aware of. The yellow flags, that is the psychological and mental well-being. So another category of patient that you might be seeing is so you need to be very much vigilant in diagnosing in between an actual mental health issue patient and actual patient with any other issue. So let's say there are two patients coming to you. One patient is 70 years old and he is having Parkinson's or stroke. He has a low diet history, diet intake is low, and he is very lean and thin. Second patient is coming to you who is 25 years old, college going teenager or boy, adult, and what he is complaining of, he is coming to you, he is telling you his complaint, but he is like this, doctor, this happened and this. So this low sort of tone, his eyes, how he is talking, the confidence level of the patient, so all these things. So now that patient with 70 years age and thin build and low dietary intake, I can presume that because of the old age, because of the medication he is taking for Parkinsonism, because of the pathology of Parkinson's, that slowness that comes into action, that might be the reason for that, the things he or she is exhibiting at 70. That sleepiness is, I can presume that thing, that I need to be cautious of that thing. So I will not mark it as a mental health issue until and unless any other thing comes into action. But for a 25 years old adult who's I presume would be very vigilant, who's not having any medical history, so in that person, if you are seeing symptoms of these sleeplessness and all these issues, this sleepiness when he's coming to your clinic, lethargic, fatigued, and lack of confidence, so the very first question you should be asking him or her is about their job profile, about their social history, about their any mental health issue they would be having in the past, if diagnosed, or if not, you will be diagnosing it with the help of a multidisciplinary approach with other health professionals. So because in that patient, if you will go in the history, he might be exhibiting some history. So I can tell you some sort of history which generally people tell, that I was working 2 years back in a multinational company, was getting a salary of around, let's say, 1,20,000 a month, and my monthly expenses are 1 lakh a month, right? After the 6 months, my job, he got some injury, let's say he got a fracture or something. Because of that, he had to sit at his home for 3 to 4 months, and the boss threw him out of the company. Now he was jobless for next 4 months. His salary was, he didn't have any job, so he had to use his savings, and he was very stressed because of that thing, and because his expenses have got very on the higher side, and he was not able to cope up with that thing. So he got restless, he got anxiety was converting into depression, and the depression and the stress led to postural issues. The person starts bending like this. See, there are two types of personalities. One is like straight standing and talking in an eyes to eyes manner, right? That is confidence personality. The other one is a low tone. A low tone exhibits a posture that is bent and talking to you like this. So you will see forward head posture round shoulders, slouch posture, and these issues, what will happen along with these issues in the longer run, what happens? So whatsoever food they intake, the intake of food, whenever they take the food in, so it goes to the stomach, down through the intestine, and so that way the digestion of food is also hampered. So every time they are taking food, then they are sitting in a low tone, in a slouch posture, their body is bending like this, the front part of the stomach starts bending and starts being compressed. The food is not being passed properly through the intestine and digestion gets hampered. Along with that thing, it has been found that in people with in every individual out of 4, so if you have 4 adults standing at some place, there might be 1 out of them who would be having a mental health issue. So it's so big issue, you can presume like every 1 out of 4 individual can have this. So if we go by the definition of WHO, that is World Health Organization, what is health? Health is a state of complete physical, mental and social well-being, and not merely an absence of disease or infirmity. So if I ask an individual, are you disease free? So he may say yes. If I ask him, are you healthy? Then also, because of lack of awareness, he or she might say yes, I am healthy. But if he is able to do all his activity without any fatigue, without any issue, then he is physically fit. The physical component of health is covered. Second thing, if he is not having disease, then absence of disease component definition is covered. If he is having good friends, the social component is covered. So how about the mental component of health? So mental component of health plays into action because the people have stress and they generally don't have that much friends whom with they can't share their views, and also the medical system is not that much supportive and it is a sort of stigma to have a mental health issue, and people are not aware of to whom do we need to discuss the issues and where to get treatment. So being a physical therapist, researchers have discussed in the past as well. It was conducted in a hospital, and the research study, what happened, it was a psychiatric hospital and patients with anxiety disorders were brought to a gym. Some of them were given normal antidepressants and anxiety medications. Others, half of the group was given exercises in the gym. So what was found after the study, that the people who got the exercise session were much improved, much better than the other group. So signifying a greater importance of exercise in the mental health, and in turn the physiotherapy. So what exercises? So if a person comes to you and you ask him, how active are you? Do you do some exercise? So people say, yes, I do this exercise. This. Okay, I do this. So this is a sort of generalized activity or a bit of physical exercise. Or some might say that I daily go to my office. My office is 30 minutes walk from my home. I walk daily. But I presume what happens is, if I am taking 3 chapatis a day, okay, taking it the other way around, so 3 chapatis means I can easily go up with them. It is normal for my body. Likewise, if 30 minutes walk you are doing from last 20 years, that is a new normal for your body. So the thing that is a new normal for your body will not help you in gaining the fitness you want and will not help your mental health issues. So for that thing, you should be telling them exercises and not physical activity. Exercise means a physical activity that is properly structured, properly designed according to the FIT principle. That is, it should be having proper frequency, proper intensity, time duration, and a particular type of exercise, be it aerobic, anaerobic, strengthening exercise, resistive exercise, or whatsoever it is. So for patients with mental health issues, the best exercise suited for them are running, swimming, cycling, and stair climbing and all they can continue. But now comes into action, what sort of exercise should we go with different sort of patients? because every patient is not same. Because I told you the domain, the levels from a low level anxiety or stress to a high level full-fledged obsessive compulsive disorder. So let's say a patient came to you and you are giving him some empathy that okay, no worries, you'll get better. And he's a patient of OCD, obsessive compulsive disorder, and he's thinking in his mind, this doctor is touching me again and again. Oh, he just touched me with his corona affected hands. Oh my god. So that is the thing. So this is OCD. You are showing your empathy to the patient, and the patient would be thinking because of his OCD, he would be having that perception in his mind that the doctor may affect me. I need to be very cautious. He'll be washing hands every now and then in front of you. He'll be avoiding you this way. So, but your action should be, you should be patient with the patient. Your entity is showing patience with that patient. So whensoever you will be showing this entity, then only you are a great physical therapist. And with latest research, it has been found that the more you engage with the patient, you take out the minute details of the patient, you listen to the history of the patient, then you can actively cover up these mental health issues. A patient with a low back pain history, okay, what happens is, in general practice, a person is coming with a low back history which has been with him, let's say, for the last 10 years. He is going, after every 2 months he is changing physiotherapists and orthopedicians. Now everyone diagnoses him, gives him some exercises, but not tackling the main issue. So what happens is, the patient comes, they give him exercises and send him home. After some time, let's say after 1 month, when the patient is not getting better, what they tell to the family of the patient, I don't think he has any issue in the back. He's all right. He is not having any positive, diagnostic signs or any positive special tests. So I won't say that he is having actual issues. He is just acting, or he is mimicking the issues. Or else you would say that he is not willing to work, that's why he's saying this and this thing. But it's not so. Every physical entity, every physical issue a person complains you about, okay, be it a minute pain in my tip of my finger to a major pain in my shoulder or stomach or anywhere, it has a psychosocial or psycho component involved. Psychological role plays a big thing in this matter, because whensoever I get pain, let's say if an IT professional is working on the laptop for 8 hours, 10 hours a day, and his wrist is directly on the edge of the table, and he's working like this, here's the table edge. Now he's typing the whole day around, 8 hours, 10 hours, now in this lockdown 15 hours. So what happens is, this area, because of constant pressure, what happens here? So to tell you what happens at this area, I would like to do a small activity. So what you people need to do, this thumb and this thumbnail, you need to press your palm with this thumbnail and dig your thumbnail into the palm, and let us count for a count of 10. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Now look at your palm. This area which I pressed with my thumb is completely red. So why is that so? Because this area was under pressure, blood was not flowing properly to this area, and as soon as I removed my hand, the blood gushed towards this area, the blood flow increased and this area became red. So you presume that person is keeping his hand on the edge of the table for 8 hours without any rest. So what would happen to his wrist? Complete pressure will lead to complete blood flow blockage, and ultimately in the long run he will be having many issues. Now we were on the mental health issue. How can we connect this thing to that thing? So if he is having this pain repeatedly, there is neurogenesis and new changes in the brain activity, and the brain presumes that every time this pressure will be there, it should be painful. So next time, even if that much pressure is not there, even if the intensity and duration is reduced, it's not 8 hours, it's just 1 hour or 2 hours, you'll start getting pain. So the brain got sensitized because of that pressure, constant pressure. So the neuroreceptors gave that signals that now this issue is giving pain. So what you should do, I mean they are telling the brain that what they should do is inhibit this activity of the pain activity. So what they'll do is after 1 hour of activity they'll start giving the pain. So now you should be very much vigilant that any patient coming to you with a physical disorder can have a mental health disorder. Specifically with research, it has also been found that patients with mental health disorder have 70% more risk of getting a cardiovascular disease, along with 75% of the mental health issue patient they succumb to death within the next 10 to 15 years. So they have a life expectancy that is 10 to 15 years shorter than the normal individual. So keeping these things in mind, what can you do for a patient with mental health issue? First and foremost, as I told you, you should be telling him to be as physically active as possible, because physical activity will help to increase the endorphin level in his or her body. Endorphins will go to the brain. It will promote the neurogenesis along with euphoria. Euphoria is a feeling of happiness that yes, I am satisfied. Second thing, when he or she will be going to the gym, he or she might be needing a friend as well to help them for support, for workouts and all. So their social aspect of health is also covered. So they'll feel better, because after some time they'll be sharing their thought process, their feelings, their views with that patient and that person, their friend only, and they'll be feeling better, because whenever you share your views with someone, you feel great, you feel light. Other thing, the best part of physical activity is when you will be going to the gym. So what will happen is, because of the physical activity, your body will grow bigger, or if it will not grow bigger, you will grow stronger from within. So your endurance, strength, flexibility, power and your skills will be better in doing everything. So you will feel like, yeah, I'm able to do everything. Earlier the person's brain process was something like, oh, I can't do anything, I don't have that much energy, so he's not satisfied with anything, he's having low confidence, low self-image, low self-esteem. Self-perception is completely damaged. So now, because of the physical activity, because of the systematic exercises which you will be prescribing that person, he or she will be doing that in the gym or in your clinic, and they'll be fantastic. They'll feel like, okay, I'm having more energy, so more satisfaction with themselves, a better self-image, a better self-esteem, better confidence, better in everything. Alongside, if you tell them, okay, now you do these activities along with a morning walk outside in the park or something. So when they go to the park, there's sunlight that's coming. Sunlight leads to vitamin D absorption in the body. Vitamin D will lead to increase in the euphoria feeling and betterment in the body tissues. So that also promotes better well-being on the mental aspect. Third thing is, whenever he or she will be doing exercises, the risk of cardiovascular disease that was there, that was heightened because of the mental health issue, will be lowered. The risk of diabetes, obesity, that was increased because of the inactivity of that individual, because of so much of stress that he was low the whole day, he was not doing anything, and now he is active, energetic. So that issue will also be taken off. So obesity gone, diabetes gone, hypertension gone, and the person is bloom. Yeah. And last but not the least, you should be taking out the addiction out of that patient. So if he or she is addicted, so what happens is, because of mental health issues, to get rid of these issues, they find an alternative, either in the form of cigarette smoking, tobacco smoking, alcohol, or some sort of bad activities they might get into. So what you need to do is, so because why do they do that? Because in the brain we have a chemical called neurotransmitter called dopamine. So now dopamine gives a feeling of reward feeling, right? Whenever you do something good or nice for your body, or you feel good, dopamine is released. So what will happen is, whenever to counter that mental low level of mental well-being, what they will do is they will take some alternative addictions like this all these I told you, smoking and alcohol and all. So what you need to do is you need to give them another addiction, an addiction of exercises. So when you will give them addiction of exercises, so what will happen is, now exercise when done repeatedly will give them a feeling of increase in dopamine. So the dopamine that was increasing because of alcohol or smoking, now it will be increasing because of the exercise level. So that exercise level will increase the dopamine and they'll feel rewarded inside the inner being. And when that happens, they can go to a better well-being. Alongside, he or she can practice some yogic asanas or pranayams, the breathing exercises that can promote the oneness of the body and the soul. And on your part, you should be working in a multidisciplinary team and give the best possible exercise routine for these patients. According to the ACSM guidelines, American College of Sports Medicine, they recommend that they should either do aerobic activity or strength training activity and repeat it 3 to 4 times a day. So daily about 30 to 60 minutes activity 3 to 4 times a day can promote a better mental being in that individual. So these things, if you keep in mind, you can formulate a finest program for your patient. But still, if you feel any issue at any time, you can contact us and get help in the same. So with these words, I would like to conclude. But you should remember that it's your learning process and it should continue. Lockdown might continue or not, but your learning process will continue forever. So keep on learning, keep on growing, stay connected. Thank you.